Hello, I'm Raquel and I'm going to introduce you the topic we will discuss in this video, general surgery. We chose this specialty because we think it's one of the most interesting of the career. Moreover, it's closely related to what we are studying this year in anatomy. Although this specialty has called a lot our attention, we don't all see ourselves working on it in the future. The points in which we have divided this video are definition of the profession, talking about what they do, how much do they earn. The second one are qualification needed for the profession. Then a couple of examples of what this specialist does, and finally a brief conclusion. Later on, that would be explained by Claudia, Cristina, Sonia and Maria in that order.
General surgery is a surgical specialty that focuses on the digestive system or abdominal contents, including the gastrointestinal tract, hepatic, biliary, pancreatic system, and endocrine system. They also deal with disease involving the skin, breast, soft tissues, and hernias. If you want to be a general surgeon, what you need to have is skillful hands, and you can be afraid of blood. Moreover, you need to know the human anatomy perfectly. Most of the interventions in general surgery require similar instruments except rectal, breast, and thyroid procedures, which require special instruments. This is a well-paid profession because it's one of the specialties that takes more years to study. You must work hard and spend many hours at the operating room.
Hi, I'm Cristina and I'm going to talk about the qualification needed for the profession. To be general surgeon, it's necessary to study medicine. Then you need to make the MIR exam. The MIR exam is a test to take place as a surgeon in a hospital. Nowadays, the degree in medicine are 6 years. Later, when you make the MIR test, you have to practice 5 years in a hospital. The system can be changed and will be more exam for to be general surgeons. The new system will be more difficult, but today it is not valid. To be well qualified must be updated on new techniques and never stop to practice. It is an old specialty and therefore requires many years of preparation.
Hi, I'm Sonia and I'm going to explain an example of general surgeon. General surgeons are responsible for multiple operations, including the operation of appendicitis. This is a very common operation which involves removing the appendix if it has an inflammation. This human organ not have a clear function, so we can do this operation and the body after the surgery is followed by a recovery. Another common operation is to remove the gallbladder if stones are formed here. The gallbladder function is only to have bile, so it's not having an important function. After this operation, could lead a normal life.
Summing up, I'm gonna explain the main points of our video, making a brief abstract about the points that my colleagues have already explained. The general surgeon handles the surgery related to digestive and endocrine systems. To be a surgeon, we must have a lot of knowledge about anatomy and have skillful with hands. To reach this goal, we must study hard and for many years, in addition to going through the MIR exam, although with changes designed to make the career could have more years of study. Some of the operations they perform is the operation for appendicitis and gallbladder stones, as they are common pathologies in the population and they are simple surgeries that shouldn't lead to complications. And that's all about the specialty of general surgeon. I hope you like it.